So a lot of us have discolored teeth. It's not something we enjoy. It's not something that we realized how we looked, but over time, a lot of us can get gray, brown, spots on our teeth, a lot of different causes. So today we're with Dr. Pashmini. We're going to talk about the causes and treatment options for tooth discoloration. Welcome, Dr. Pashmini.
Thank you.
All right, so some folks have spots, some people have seen significant color changes. What's going on and what are their treatment options?
Of course. So majority of the discolorations we see, if I had to quantify how many patients we see every day, about 80% of them, I would say, is diet related. So we're getting brown and yellow teeth. It's a lot of it coffee. We all love our coffee, tea, a lot of newer drinks like beet juice, turmeric, saffron, matcha green tea, all of this stuff that are so good for your body, they discolor your teeth. Of course, things like wine that we all like, so that's also a culprit as well. Those are usually the easy ones to correct. So some bleaching treatment, some whitening treatment will take care of that for majority of the time.
And no
Now,
more
of
beet
course,
juice.
you have to.
You got to stop the beet juice. All right?
Yes. Well, I love beets. So no, drink your beet juice, but you got to brush your teeth afterwards to get it out. Same goes with coffee and tea, but just over time, exactly as we get older, there's just been more years and years of drinking and eating these products. So teeth tend to get darker as we age. Bleaching will usually take care of most of those stains. Now, sometimes if people have really crooked teeth too, teeth are not contacting correctly. A lot of stains is getting stuck between the teeth. So that's even hard for us to clean here. We will discuss maybe straightening the teeth followed by bleaching. So there are a lot of ways to actually prevent even more staining down the road. Now, the other 20% of discolorations could be things like amelogenesis imperfecta, which is like the enamel just did not form correctly as patients were getting older. That usually will require restorative dentistry, things like that, to try to cover the tooth surface to change the color for them. A lot of times the teeth that are gray in color, especially if it's just one tooth that's gray in the mouth, that's usually a tooth that has had trauma in the past. Tooth can die under trauma. It could be something, you were a kid, you fell and hit your face on a bike, and now as an adult, you're starting to see discoloration in the tooth because the tooth died years ago, but now it's actually starting to show the color. Usually, the treatment will require root canal treatment to remove the nerve. Sometimes if there's no nerve remaining in the tooth, we can talk about a veneer or even internal bleaching to bleach the tooth from inside out. Other discolorations are a condition called fluorosis. Fluorosis is basically very deep brown staining on the teeth. It's usually caused by exposure to too much fluoride as a child. We're not talking the regular fluoride varnish or regular amount you get in your water. We're talking patients who maybe grew up on well water and they had a lot of additional fluoride added to their diet and as treatment to them as they were a kid. So those are more rare situations that we see, but generally speaking, majority of the discoloration is diet related. And also oral healthcare, right? Like if you're not brushing your teeth, if you're not flossing, then of course you're going to get a lot more
If you're not
staining
brushing
on
after
those
that
teeth.
beet
But
juice, yes. Now I want to
yeah,
try
your
beet
teeth are
juice.
going to be
Sounds
pretty
good.
red.
Yeah.
Oh, it's delicious. You definitely should.
Well, we all eat and drink a lot of different things, so obviously it sounds like there can be a lot of different causes, but they're all treatable. So it starts with obviously a conversation. So good to hear. I think a lot of people want those brighter, natural-looking smiles. They got a lot of options to correct that discoloration. So very informative. I'm sure people found this of interest, and thanks for your time, Dr. Pashmini.
Of course, my pleasure.
All right, take care.